Hi everyone, today's video is for discussion 1B, Foundations of Health Promotion. Before jumping into the prompts, here's a quick overview of what I'm actually talking about here. Because yes, health promotion can sound like one of those phrases where everyone nods without fully unpacking it. At its core, health promotion is about helping people stay healthy before things go wrong, so that we're not just reacting to disease, we're actually trying to prevent it. This includes things like encouraging healthy behaviors, creating supportive environments, improving access to care, and ideally, making the healthiest choice the easiest choice. Disease prevention works alongside this and is often divided into 3 categories. Primary prevention, where we stop illness before it starts. Secondary prevention, where we identify mechanisms for early detection. And tertiary prevention, where we manage the disease to reduce its complications. So basically, there's a little less fix it later and more let's not break it in the first place focus. For this discussion, I'm asking you to respond to 2 prompts. I'd like you to focus on why health promotion and disease prevention are important, along with very specific examples, and challenges in health promotion and how they can be addressed. So you may be asking yourself, why exactly are health promotion and disease prevention important? Well, I hope you already know the answer to that. But health promotion and disease prevention are important because they improve quality of life, reduce healthcare costs, and perhaps most importantly, help people avoid preventable suffering. And yes, avoiding unnecessary suffering is generally considered a good thing. From a systems perspective, I want you to consider preventative care and how it reduces strain on healthcare systems, how it lowers long-term costs associated with chronic diseases, and how it leads to healthier populations overall. Some successful examples include vaccination programs, which have dramatically reduced diseases like measles and polio, anti-smoking campaigns, which have lowered smoking rates and reduced lung cancer incidence, public health initiatives promoting physical activity and nutrition, which help reduce obesity and related conditions. These efforts work because they combine education, policy, and access. They're not just telling people what to do, but they're actually making it possible to do it. So let's move on to talking about what challenges exist and how they can be addressed. Of course, if health promotion were easy, we'd all be perfectly healthy all of the time, and this discussion board would not exist. There are several major challenges here. Behavioral resistance. People don't always make healthy choices, even when they know better. Because having more knowledge does not mean that people take action. If it did, we'd all drink more water and be sure to sleep 8 hours a night. Social determinants of health, factors like income, education, environment, and access to care can all make healthy living difficult. It's hard to prioritize nutrition when healthy food is not accessible or it's just not affordable. Health disparities. Certain populations face greater barriers due to systemic inequalities, which leads to uneven health outcomes. And misinformation, such as conflicting or inaccurate health information, especially online, can reduce trust and influence poor decision-making. Addressing these challenges requires a multi-level approach. Education, that's clear, culturally relevant, and actionable. Policies that support healthy environment, like access to parks and healthy foods. Community-based programs that meet people where they are. And improved access to preventative healthcare services. In other words, we need to stop acting like health is only an individual responsibility, and we need to recognize that systems and environments play a huge role in this. Overall, health promotion and disease prevention are essential for improving both individual and population health, but their success depends on more than just good intentions. It takes coordinated efforts across healthcare, policy, and communities to make a real impact.